Hello, I'm Dr. Lisa Bagnall. My colleagues, Dr. Sanju Yu, Dr. Oliver Grunman, and Ms. Marilyn Teolis, completed one of the first formal systematic reviews on the biomarkers and mechanisms related to cancer-induced cardiac cachexia in its natural state before any intervention. This particular video is a short synopsis of the differences between cachexia and sarcopenia. And the reason I'm splitting this off from the main large video that I'm creating is because there's still a lot of confusion about these two syndromes. Many healthcare providers still use them interchangeably, and yet they are completely different processes. Cancer cachexia in itself is a multifactorial syndrome that affects up to 80% of patients with advanced cancer. It causes multiple organ damage and the loss of skeletal and cardiac muscle proteins and breakdown, as well as mass. The wasting is a result of protein loss and it's associated in the heart with increased oxygen consumption and energy expenditure. The cancer progression causes cardiac wasting associated cardiomyopathy, and this is evidenced by remodeling, the thinning of ventricular walls, local tissue hypoxia, and lethal dysrhythmias. The differences between sarcopenia and cachexia are pretty profound. Cachexia is a very complex metabolic syndrome that's irreversible and it's progressive and it's always associated with an underlying illness such as cancer, heart failure, and other conditions. It is characterized by the loss of muscle or the breakdown of muscle in actuality, with or without the loss of fat. The definition includes a weight loss of 5% or more in a 12-month or less period. It also has to include 3 of the following criteria: decreased muscle strength, fatigue, anorexia, and abnormal biochemistry. Sarcopenia, on the other hand, is different. It's merely the loss of muscle mass and strength. It's not the actual breakdown of the muscle itself. Primary sarcopenia is loss of muscle mass and strength due to aging, whereas secondary sarcopenia is loss of muscle mass and strength due to something other than aging. For example, reduced activity and immobility is one of those causes. Think of your patient who's in bed for a week in the hospital without physical therapy. In an elderly person who remains in bed for a week, that equals 3 weeks of rehabilitation or physical therapy and good nutrition in order to regain the loss of function that happened or occurred during 1 week of immobility. The general rule of thumb is for every day spent in bed takes 3 days of rehabilitation to regain that function lost in 1 single day. Other causes of secondary sarcopenia include chronic disease and poor nutrition. The diagnostic criteria for sarcopenia include screening by a questionnaire, the SARC-F, and clinical suspicion, followed by the assessment of muscle strength. This can be done with a grip test or the chair to stand test. Muscle quality and quantity through bioelectrical impedance analysis, dual energy X-ray absorptiometry, CT scanning and MRI imaging, and physical performance tests such as the gait speed, the short physical performance battery, the timed up and go test, which is used very frequently in rehabilitation settings to assess PT progression versus PT regression, and the 400-meter walk test. All of these criteria help to determine how severe sarcopenia is. So again, in recapping, cachexia, irreversible, complex metabolic syndrome, always associated with the underlying illness. It is the breakdown of the muscle itself and through the breakdown of muscle proteins. Sarcopenia, loss of muscle mass and strength due to either aging or chronic disease. I hope this was helpful in differentiating between these two syndromes.